This was the sound a Hobart family was waiting to hear. Instead, almost 40 minutes after they called 000, they were told there was no ambulance available and they should call a taxi. During that cab ride, the 13-year-old boy stopped breathing. He survived and spent 7 days in hospital, including 2 on life support.
At times people will choose to make the decision to use other modes of transport to get to hospital, which they're entitled to do.
This is the first time in Tasmanian history that we have a government that doesn't believe that having an ambulance available is a basic level of service.
It's not the only time someone's had to take a taxi instead of an ambulance. In his 45 years of driving a cab, Michael Cripps has made many trips to the hospital. In some cases because people haven't wanted to wait for an ambulance, and on at least one occasion because the ambulance didn't turn up.
It's a bit nerve-wracking. You just sort of keep one on the road and one on them.
The government says people can choose how they make their way to hospital.
I'm not going to stand here and tell people what decisions they should make in terms of when an emergency occurs on getting to the emergency department.
The pressure on ambulance services stem from issues at the major hospitals, which are struggling under the weight of COVID.
We still have a bed problem, but we've got much bigger pressure coming on us through the impacts of COVID, both on our staff and the increased numbers of patients who need to be in hospital.
Dr Nicholson says the health department has been trying to help hospitals deal with the increasing strain, but that it's not enough.
The problem, it's bigger. It's bigger than the measures that we've used so far.
Health Minister and Premier Jeremy Rockcliffe has been on holiday this week. He broke that leave today, not to address the state's health crisis, but to issue a statement saying he'd made it clear to AFL bosses what Tasmania's expectations are for the state's AFL and AFLW teams.
The Premier said that by him retaining the health portfolio that things would get better. In fact, they've got worse.
Lucy MacDonald, ABC News.